but it is controversial. There can be risks present, although I want to address the extreme claims that sort of scared off the entire mainstream from using iodine from Wolff and Chaikoff. So these claims are basically logically unfounded. They're speculative, saying that when these rats took iodine, they had lower than normal T4 secretion in the thyroid, and they had higher than normal TSH production in the thyroid. And that basically this is a bad thing, that the iodine is causing this, and that basically the thyroids of these rats are basically acting in a way that's bad. So now a more reasonable explanation for this, why you would see elevated TSH with somebody supplementing with iodine, it's very logical, because the pituitary gland basically intentionally raises TSH so that the cells can actually absorb iodine to help the sodium iodine symporter function of the cells. So this would be expected to see increased levels of TSH earlier when someone is taking iodine supplements, as the body is becoming saturated, and it would be wise to monitor that over several months and see if TSH drops back down after the cells have become saturated and absorbed much iodine. So somebody can test this. Now this didn't happen. They didn't do follow-up testing. They didn't do any of that. They just made this speculation, and it freaked out the whole mainstream community. But somebody can quantify levels of TSH in the body with a standard blood test showing thyroid function. But that's so logical why it would be increased. And then again, especially in the early days when the cells are still not saturated. There's also claims about the T4 decrease being a bad thing. And again, much more logical explanation is that T4 decrease is happening in the thyroid because the thyroid has become sufficient with iodine. And so basically it's absorbed enough iodine, therefore it doesn't need to secrete more T4. Now this is a more logical theory, I think, than the more dubious theory, which espouses that basically the thyroid is being blocked by the iodine and therefore it's being underactive. It seems more logical that it doesn't need to be active because it's sufficient with iodine. So this is basically, all of this, despite the fact that these concerns that were raised in the 1940s were basically theories and unfounded and not followed up on, the whole mainstream community still continues to think that iodine and higher levels of dosages are super controversial, and they can cause problems with the thyroid. And you have very smart, educated people that are buying into this without investigating and doing like I did, just a regular person, and going in and actually understanding the mechanisms to see what's going on. Now, to be fair, there are some extreme cases of individuals who the risks of taking iodine seem higher. For example, you can have an extremely rare instance of someone with a nodule of the thyroid that's so-called a hot nodule or autonomously functioning. They may have a poor response to iodine supplementation. You have extremely rare cases of people who experience iodism, which is like a reaction to iodine where they might have fatigue or a headache. That's been reported extremely uncommonly. So if something like this is happening, obviously somebody should stop and they should consult their medical professional if they need medical advice. There's also individuals who they're concerned about taking iodine because they have an existing issue with their thyroid function. So now in reality, it seems like issues with thyroid problems are more related to a lack of iodine in the body. And in fact, as part of the Iodine Project, with all these thousands of patients and all the people that have used the information since then, there are so many countless reports of people who reversed problems that they were having with their thyroids. Not just their thyroids, breasts, reproductive organs, and other systems of the body after the body became saturated. So